Hi everybody. Today I am here to answer the question, what to do when your doctor doesn't take you seriously, which is a significant concern for caregivers, for women, and everybody I know who is over age 50. Caregivers, patients, and physicians can really have different ideas, different thoughts, different goals about what matters to them. This can be vastly different. And in some cases, people may not be aware of the steps to feel better, especially if they have a nagging health condition that started small and now it's just growing and growing and growing. So, figuring out the reasons and what to do about why won't my doctor help me can relate to a lot of things that caregivers and patients don't even know exist, and really that don't matter to them. These can include federal and state standards and government requirements from CMS, which is the Center for Medicare and Medicaid, which is health insurance for people over age 65 as far as Medicare goes. The NCQA, the National Committee for Quality Assurance, also has a say in the care that patients receive, as well as private insurance companies. And you put all of these together, and this is why it can be difficult to get help from your doctor and make it seem like, honestly, your doctor doesn't care. Now, what patients may not also realize is doctors do care. However, their actions are limited by these federal and state programs and regulations. They're limited by insurance companies. But most importantly, the limitations come up when patients don't understand health conditions and aren't committed to follow through with recommendations. So, stay with me. I'm going to share tips to get the care that you need from doctors who may not care. If this is your first time here, I'm Pamela D. Wilson. I'm a caregiving expert, advocate, and speaker with almost 25 years of experience. Information about me, my professional background, career in caregiving, health, and aging is below. You'll also find links to my caregiver support group on Facebook. It's called The Caregiving Trap, my online caregiver education programs, my podcast, The Caring Generation, how to schedule one-to-one consultations with me or invite me to speak to your company or group. I do ask you, please like this video, follow my channel, comment, even if it's only to say thank you so much for this video, because this helps other people find their way here. So let's get into the regulations and the rules and why healthcare is so complicated. It's very easy as a caregiver to become lost in this healthcare system, right? Your doctor offices, whether they are part of a larger healthcare system, your insurance company over here, labs, all of that. And so as a caregiver, as a person with health problems, it's important for you to understand how the system works so that you can learn to work with the system to get the care that you need. It's also important to be that squeaky wheel to get the help that you need from your doctor. So this can include a little bit of work on your part. It can include learning processes and understanding what outcomes mean to healthcare providers and how doctors' performance and how the performance of your health system is managed and measured by Centers for Medicare and Medicaid, that NCQA organization, and your health insurance companies. So in this video, I'm going to talk about two areas and give you insights, tips, and share stories for you as a caregiver, for you as a person with a health condition who wants better care, so that you can think about these ideas and whether you want to put them into action. So the number one is I'm going to share a list of questions and links to documents on my website that you can use to determine how activity levels are associated with healthcare risks. These questions can help you identify things that you're seeing in yourself or an aging parent that might be positively contributing to your health or negatively contributing to your health. Having answers to these questions can provide a level of realism and things for you to think about for what it takes to get the care that you want from doctors and other healthcare providers. I'll share links to a support program on my website that has these lists of questions so you can go and print them out and use them. Number 2, I'm going to talk about what doctors look for when they decide how much they can help a patient or how willing they are to advocate for a patient's care, and how they gain trust with patients to know that they should take your concerns seriously. This information can help you learn what to say and do and how to advocate for your health. So under this, I'll share examples of what matters to get medical care. And again, talk about why what matters can be different. So let's get into number 1. Let's look at the first list of questions that relate to daily physical activity. So to give you an example, how much time do you or a parent spend sitting versus doing things? The responses to this question can indicate whether a person should increase their physical strength and endurance so that they can remain living independently and either not need a caregiver at all or only need a caregiver truly for the things that they cannot do. Friends, family, other people can be great emotional supports. They don't need to be helping out. So on this one, look below for the link where it says Module 2 on my website, where you can find the link to download these questions. Now, if you want to write them down, you can, but that document will have more questions. So when you think about the questions I'm going to ask, think about frequency, meaning, is this something that you or a parent does every day, and how many times a day? Or do you not do it at all? Never. Or less than once a week, or maybe 1 to 2 times a week. So in the last 3 months, how often have you or your parents or loved ones prepared a main meal? And I don't mean like warming up a TV dinner or bringing takeout home into the home. I mean like really cooking. How many times have you prepared a meal and cleaned up the kitchen? Do you do this twice a day, breakfast and dinner? Do you do it for lunch? Do you do it 3 times a day? Not at all. The same question, apply it to doing laundry, washing your clothes, doing a little bit of light housework, deep cleaning the house, leaving the home to go somewhere, whether it's to work or a social education program or shopping or meeting friends. How often do you walk outside of the home for 15 minutes or more? How often do you participate in a hobby? Drive a car, use public transportation like a bus or a train. Next, how many times a week is there participation in these type of activities? Some type of outing. Do you garden, golf, play tennis, do club activities, maintain your house, maintain your yard, read a book? Do you work? Do you volunteer outside the home? Now you might wonder, why are these questions important? Daily activity of any kind contributes to better physical and mental health. People who feel that they can complete or at least have control over their life, their daily activities, have higher levels of self-confidence and self-esteem and generally are happier. Now, when someone needs help with these activities, totally different story, because they may be physically weak, not feel well, have other health issues that make them feel less confident or able or desire to do these things for themselves. And as a result, needing help from somebody else, well, it can dent your self-esteem, your belief in yourself. And it can add a level of frustration that, oh my gosh, I used to be able to do this, and now I can't do it anymore. Now I have to wait on other people to help me, and that is the pits. So, with this list of questions, how can you easily track daily activity? Can you use a notebook, make a list, find an app on your cell phone? Or use an activity watch that I use. So if you've seen other videos on my YouTube channel, you know that I believe in physical activity and health and strength and all of that. And I actually bought this activity watch to make sure that I maintain a high level of physical activity and strength training. And so in a sense, I compete with myself. So let me share how this works with a simple task like house cleaning. Last week, I spent 6 hours deep cleaning my house. I got down on my hands and knees and I scrubbed floors. I vacuumed. I cleaned out my cabinets of old dated food. I dusted the floorboards. I cleaned the woodwork. I cleaned and sealed bathroom tile. And then after that, what did I do? I went to the gym. My activity level on this day on my watch, 257%. Yay! Now, you might wonder, why go to the gym after cleaning house for 6 hours? Well, for me, going to the gym or participating in outside regular activities like hiking or biking or whatever, it's a daily habit for me that I really do my best to continue day in and day out. Now, these activities is what strengthens my muscles, gives me the physical endurance so that I can get down on my hands and knees and wash the floor. And I can clean house for 6 hours or 8 hours or however long, right? Or I can lift heavy grocery bags or lift heavy items, bend down, kneel, do all of those things. Going to the gym for me to lift weights, to use the cardio machines, the weight machines, helps me do the things that I've always done and the things that I want to continue to do. On the other hand, doing less physically contributes to health problems and having more chronic diseases, including eventually aging and not being able to live independently, or need a caregiver, or have to move out of your home to live into a care community. So if you don't want to do any of those things, need a caregiver, move out of your home, live in a care community, physical activity and exercise, in addition to a few other things that I'll talk about, are very, very important. Now you might say, well, Pamela, I can't buy an activity watch, or I don't have money to go to the gym. Well, you don't need to. You can write it down on paper. You can use a can of green beans and a can of corn to lift weights. You can use bottles filled with water to lift weights. You can buy some small weights or weight bands. There are hundreds of videos here on YouTube about exercises that you can do in your home. You can go to a mall and walk. You can walk up and down stairs. You can walk outside. You can do so many other activities. Senior centers, which are usually free to seniors, have a lot of activities there. So if you or a parent or anybody in your life is not active every day, I encourage you, strongly consider the benefits of becoming more active, because I'll share in a moment how daily activity, physical strength, and physical endurance are factors to consider if you want a doctor to help you, to pay attention to you, to take your care seriously. These are important, especially if you want to receive better care from your doctor. The next list of questions I'm about to share can be found in the link down below, where I reference Module 4 on my website. These relate specifically to a term called Activities of Daily Living, ADL. Alan, David, Larry. Now, doctors and other health providers use this term to identify whether someone can take care of themselves or whether they may need some help, they may need a caregiver, they may not be able to live independently anymore. You hear the word ADLs, like fire engines should be going off in your head, red light, pay attention. The ability to perform activities of daily living are measurements that contribute to the likelihood of a person needing a caregiver or moving to a care community, or worst case, needing to move to a nursing home because of the need for hands-on assistance to do things that we take for granted every day. Taking a shower, bathing, dressing, eating, going to the bathroom, getting up out of a chair, moving around, safety in walking because you have poor balance and a fall risk. So here's a list of questions. What activities do you or an aging parent require help from another person? Now these are combined activities, so meal preparation, shopping, driving, transportation, using the telephone, using the toilet, housekeeping, doing laundry, managing money, picking up prescriptions, taking medications, showering, bathing, dressing, managing continence. When you need help, next question, who do you count on or call? Do you take 5 or more medications every day? How often do you forget to take your medications? Does your doctor tell you to take medications and you don't get that prescription filled? You would be surprised how many people don't get the prescription filled, or they get it filled and that bottle just sits on the table. Have you recently lost or gained weight? How often do you feel sad or depressed or hopeless, or you just don't care anymore? Do you have a problem losing control of your urine? Can you stand from a chair without using your arms to push down? When was the last time you walked a city block? The answers from these 2 lists of questions, again, the links are below, Module 2, Module 4, can allow caregivers to have honest conversations with elderly parents or other people in their lives about what they're able to do on a daily basis and what they want to do about their health. Same thing, if you're the person with the health concerns, go through these lists and be honest with yourself and say, you know what, I used to do this and I don't anymore. These answers can indicate the likelihood that you either are going to need help from somebody else, or it is time. That wake-up call has arrived for you to make a plan to reverse these things that you cannot do anymore to going back to doing them every single day or as often as you need to. Number 2 on the list here. Let's talk about what doctors look for when they decide how much they can help a patient or how much they're willing to advocate for a patient's care. How much are they willing to put their reputation on the line to help you, especially if they have to advocate with other doctors or your health insurance company, or they have to advocate for test results. Part of this can involve what matters to you as a caregiver. So I'm going to give a practical example about this. I have had doctors say to me, well, patients lie. I ask a patient and they don't tell me the truth, and I know they're not telling me the truth because I'm not seeing positive changes that I should be seeing if they were doing what I asked them to do. Establishing a level of trust with your doctor is critical. It's important to having a doctor to help you. So if you don't have a regular doctor that you see, that is the first action to take. Don't just show up at the hospital emergency room or that clinic and help them and expect them to help you when you haven't helped yourself establish a regular and trusting relationship with a doctor who knows you. So what is that solution to doctors believe that patients lie? Well, a couple of things. Having a regular, established, trusting relationship with a doctor. Number 2 is documentation. So again, let's go back to my activity. My activity watch. It connects to an app on my phone where if you ask me, I can show you my activity by day, by week, by month. I can take that activity down to the average number of daily steps I take. The recommendation for everybody is 10,000 steps a day. I can tell you how many miles I have walked, biked, hiked, how long I've done strength training, the number of days I'm active, which means not sitting down, how many calories I burn, how many hours I sleep every night, and my high and low heart rate for the day. This data can help a doctor know that a patient is committed to physical activity and health. It makes a huge difference. So for me, what matters is the ability to be physically active and take care of myself and do all the things that I want to do and not have to rely on someone else to do any of these things for me. This is what matters to me. So let's look at any active person who has a health issue, and maybe they have to have surgery. Maybe you're a sports enthusiastic person and you need a knee replacement or tore a rotator cuff or something. And what matters to you is you want to go back to doing the things you did before: skiing, golfing, playing tennis, hiking, whatever. And you want to do this as soon as possible. So if that's the case, your doctor probably is going to advocate for the surgery because they know that after surgery, you want to do these things again. So you're going to return to that prior level of functioning. On the opposite end of the spectrum, if you are a person who is not active and you've never been active and you have a health problem that requires surgery, what's your goal? Is your goal to return to being inactive? Is your goal to continue living in your house? Is your goal to be healthier now that you've had this thing happen? You're thinking, maybe I should pay more attention to my health. Any type of surgery is very traumatic to the body. Any type of recovery after surgery, it's going to take a lot of work and commitment and maybe going through physical therapy and exercise for months. If you're a person who's not active and you have a lot of health problems, your risk of surgery is way up here. It's higher than a person who's active, right? And your doctor, believe it or not, looks at this. Before surgery, all these teams of people get together and they look at your health record. And they're like, oh my gosh, this person has heart problems. And they have this condition and this condition and this condition. Are they going to be able to physically recover? And are they willing to do what it takes? So if you think about why a doctor may not take you seriously or may not want to help you with your health, the first question to ask yourself is, do you take your health seriously? Have you taken your health seriously? If you have not taken your health seriously, what are you willing to do to take your health seriously? What do you do every day that improves your health and well-being? Caregivers and the people they care for must seriously think about all these aspects of daily life and what a person is willing to commit to before and after surgery. Let's say that you're not active and you need surgery. One of the things you might be surprised to know is that committing to a pre-surgery exercise program can kind of help you get on that runway, get on that daily activity plan to continue those activities after surgery. Because if you're physically weak before surgery, you're going to be physically weak after surgery, and probably more physically weak. So let's say you're here after surgery, you're going to be down here. You got to work your way up to just where you were to be at regular daily activity level. So what if you were willing to commit to a pre-surgery exercise program and talk to your doctor about that and ask about that? So this is the difference between just allowing things to happen in your life versus taking control of your health, your mental health, your physical health, your well-being, your daily activities. You have so much more control over this than many people realize. And most people don't realize this because they don't have access to education and information like these videos. So again, please like, please share, send this video to people you know, comment. Even if it's only to say thanks for the video, it helps other people find their way here. So what else can you measure to show your doctor that you are committed to your health? Well, it depends on what's going on with your health. Do you take a lot of daily medications? Do you take them every day? Is nutrition a concern? What are you eating? Healthy foods or junk foods or boxed foods or processed foods? If you have diabetes, do you take readings for your blood sugar every day? Do you take your blood pressure if you have high blood pressure? Do you take your oxygen if you have breathing issues? Are you monitoring your weight to make sure that you're not gaining or losing weight? Or maybe you do need to gain some weight, or maybe you need to lose some weight. Do you take your daily temperature? What health conditions and what readings can you take daily to know that you're doing a good job? Because what you measure relates to what matters to you. The daily things you do every day relates to what matters to you. What matters to you may be, I need to be healthy enough to have a job to support my family. I need to be healthy enough to take care of my mother or my grandmother. And so, again, what matters can be very different from the caregiver to an aging person in your family to somebody else. So let's say that your mom or dad or grandma has a long list of health problems, like 5, 10, 20, right? And they don't do a lot. They're inactive. What's important to your parent? Is watching soap operas all day the most exciting thing that they have to do? Is that phone call from you the most exciting thing that they have to do? Is seeing their grandkids the most exciting thing that they have to do? What is important to anyone is a key to what motivates people. If you're the person with the health problem, what's important to you? What motivates you? What gets you out of bed every day? If you don't have anything that gets you out of bed every day, what might get you out of bed every day? So go back to those questions, those 2 lists that we reviewed at the beginning of this video, and look at your life. What has changed in your life in the past month, 2 months, year, 3 years, 5 years? What's changed? What do you do today versus what did you do before? Are you doing more or are you doing less? How has the level and frequency of your activity increased or declined? Are you less motivated? Do you just not care? Do you feel apathetic or hopeless? That may indicate you're depressed. If you have pain, is it due to sports injury, arthritis, another condition which might be able to be addressed by your doctor? Ask yourself or your loved one, if you could change any aspect about your life or the way that you feel every day or your activities, what would you change? And then figure out, how can I change this? Is it practical for me to change this? To what degree can I change or improve this thing? And then get to work. Asking yourself these questions may help you understand what matters and what on earth motivates you. Now, it's important to consider that if your loved one that you take care of has never exercised or been physically active, this kind of opens the door for discussions about, do you want to get better care from your doctor? Do you want your doctor to take you seriously? What are you willing to do? So part of this can be requesting a physical therapy evaluation from a doctor. If you are physically weak and you want to get stronger, or you have balance issues, or you don't walk evenly, or you've had a recent fall. Let's go to the next thing, nutrition. Nutrition for older adults is even more important because bodies process food differently with age. They process medications differently with age. If you're not quite sure what you should be eating and not eating, ask your doctor for a consultation with a nutritionist. Have them help you figure out a meal plan. Then on the other end of nutrition, if your loved one has issues with eating, do they have teeth problems, dental problems? Do they need to go see the dentist? Are there any type of swallowing or choking issues that can happen with age or with a diagnosis of dementia or Alzheimer's? Looking at every little change in your life and saying, why did I give that up? Why am I not doing that? What's entered into my life that's caused this change? Why has it occurred? Why have I allowed it to occur? Allows you to investigate root causes. Let's look at other things. Older adults take a lot of medications. Medications can help, or they can hinder, or they can have side effects. So are the medications your parent is taking helping? If not, go back to the doctor and ask for a different medication. If your doctor prescribes a medication, are you saying, hey doc, what's this medication for? What condition do I have? What else can I do to help this condition in addition to the medication? So be the person who takes an interest in your health. Because if you don't, your doctor cannot possibly give you the information you need if you don't ask questions, if you don't take an interest. Asking about the consequences of what if I do this versus this, what if I say yes to this and no to this is important. You have a right to ask questions and to have your questions answered. Don't let your doctors rush you into anything until you get the questions answered. Because rushing into something, if you don't know the consequences, can have even worse consequences for you. And I get it. This can be a challenge because doctors have this limited time to see you. And some doctors only want to give you this limited amount of information because they think they know best based on all the other patients they talk to. Well, that may not work for you. I'll tell you, it doesn't work for me. I want to know everything. I want to know consequences. I want to know what happens in 6 months or 9 months, pros, cons, all of that. So if that's the case, your doctor has to know that you're going to have a lot of questions. And if they can't answer it, then who's the next person? Give me a doctor that has more time to spend with me. Give me another doctor who is more willing to help. If you don't like your doctor, change your doctor. Now, you can also ask a doctor if they're making a recommendation. How many patients do you see in a similar state of health? How many patients have you treated for this? Surgeons, how many operations have you done for this? Because it's important for you to know if they are looking at you like a person who's in this category of 40-year-olds or 50-year-olds or 60-year-olds, and they're looking at averages. Well, you may not be average. You may be above average. You may be below average. I don't know. So when they use guidelines across a certain population, this may not work for you. If you don't speak up, you're not going to get the care you need. One size fits all healthcare, even though physicians tend to group patients and they like to, does not work for everyone, which is probably why you're here watching this video, because you're not getting the results you want from your doctor. So if you want attention, again, if you want your doctor to help you, you have to show that your situation is different. You have to give them data. You have to be convincing about why you want what you want. And in some cases, you may not know what you want. You may just want to know that I want to feel better. I don't know what that involves. Ask your doctor. In some cases, if what you want is not practical, you may need your doctor to say, well, why won't this work? Why did this information I find on the internet, why is this not reliable? Tell me. And in other cases, it may work. You never know unless you become this tireless advocate who is interested in yourself and your health. And this is true whether you are healthy or whether you are unhealthy. Both sides, you have to advocate. When that doctor ignores you or won't give you time, it's up to you to be the squeaky wheel. What facts, what data, what documentation can you provide about the concern, about what you're doing to address the concern, about how it happens, about how it negatively affects your daily activity or positively affects your daily activity? If that physician's suggestion doesn't work, make another appointment. Keep searching for solutions. Call the doctor with concerns. Send notes through the physician portal. Be persistent. A level of persistency will tell your doctor that you're serious about finding a solution. And in some cases, if your primary care doctor can't help you, ask to see a specialist. In a perfect world of healthcare, you have a physician you trust and a physician who trusts and believes in you. You have a physician who's willing to advocate for your care with other doctors, with specialists, with people they work for, because you're a person who does what you say. You follow doctor recommendations. You give them feedback. You want to be healthy. You're willing to do whatever it takes. Now, let's say that you don't fall into that category. On the other hand, you don't want to be proactive or aggressive about your care. Then that discussion shifts to, how do I manage these conditions with the least amount of work, with the least amount of medications? I'm not looking to improve my health. I'm just looking to stay the same or not get worse. Because not everyone, and this is very hard for caregivers, wants to or can make an effort to improve their health or even maintain it. There is some point in all of our lives where some health condition is going to take us downhill. And it's going to get worse, and we're going to have to learn how to deal with it. This can be a huge gap for caregivers over here and the people who need care over here, who are butting heads saying, Mom and Dad, I want you to get better. And Mom and Dad are saying, they're refusing care. They're not doing it, right? But you're not saying, well, Mom and Dad, is it just that you don't want to get better? Are you tired of working on this? They may say yes. Then it's up to you to accept that and find a way to manage that level of health with help from your doctor and other providers. You, me, we're responsible for our health day in and day out. Our actions every day dictate our health day in and day out. Gather information so that you can make informed decisions and choices about your health to live the best life you can under the circumstances that you have, with the diagnosis that you have, with the habits you're willing to change, with the things that you're willing to do or not do. I thank you so much for being here. I am Pamela D. Wilson, a caregiving expert, advocate, and speaker. Please look below this video. You will find links to my online caregiving programs, my podcast, The Caring Generation, my online caregiver support group, The Caregiving Trap, ways to schedule a one-on-one consultation with me, ask me to come speak to your group or association, and a lot of more helpful information. Again, please like, follow my channel, comment. Your comments, your interactions help other people find their way here. Have a fabulous day. I will see you all again soon in another video.